Hello and welcome. We are watching News9 Live. I'm Krishna Kumar and we are taking up the issue of the safety for women in workplaces, even as the horror in Kolkata continues to dominate headlines. Now, let's begin with that shocking incident from Kolkata which has been dominating headlines. A trainee doctor at RG Kar Medical College was raped and murdered, sparking nationwide protests. So far, 19 arrests have been made in the vandalism that happened during the protests at RG Kar Hospital. The CBI has intensified its investigation into the rape and murder of the trainee doctor. The officers also visited the victim's residence and contacted her parents to gather crucial information. Now, the incident has sparked the fundamental question related to safety at workplaces for women, not just in hospitals, but across the board. Are workplaces safe enough for women? If you're complaining about the lack of enough women participation in the workplace, are you making it safe for them to come? We have a very special guest joining us on this broadcast. We have Rekha Sharma, former chairperson of the National Commission for Women, now joining us. Rekha, thank you so much for taking time out to be with us. I want to begin by asking that fundamental question that rises in everybody's mind when you look at that horror in Kolkata. It is not just about doctors, it's not just about night shifts. It is a fundamental question of whether workplaces are welcoming enough, first of all, at a very basic level, safe enough for women to be there.
Very pertinent question. This is now every woman of India is asking this. And why it is not safe? Why the mindset of men is not changing when women have come forward and are contributing, they are contributing in every field. But why the safety and security of women is still concerned, not only in one hospital or in one way or in one city or in one state. Every woman of every state is now standing up and asking this question, and we must now act. Yesterday, as we know, the Prime Minister from Red Fort also said that women's safety and security should be the first initiative of every state. They should work on safety and security of women. So I think it is now the time that every woman should stand up and ask that this is their basic right to be safe at the workplace. Even at home, women are not safe. And it is not because police is not working, it is not because the laws are not there. Home, and when they are not safe at home, that means the mindset of the society is going down the drain. We are now, I think, morally going down. That's why such gruesome incidents are happening.
Absolutely gut-wrenching and gruesome. But Rekha, one is this gruesome, gut-wrenching incident that's a complete extreme, unprecedented, after Nirbhaya. But then again, it is not just about these gruesome incidents. It's the day-to-day issues that women face at the workplace, isn't it? And you have laws in place. You do have awareness now more than ever before, so that when women are wronged at workplaces, when their safety is harmed, then they do have a forum to make their displeasure known, to make their complaints, to file their complaints. But the fact of the matter is that despite the laws in place, despite so much awareness, the fundamental safety of women continues to be an issue, whether it's going to be this gut-wrenching gang rape or not.
You're right. There is a law, Sexual Harassment at Workplace Prevention, Prohibition, Redressal Law. That act is there. But how many people know about this act? Even women working in the offices, they don't know. The officers, they don't know. The administration doesn't know the law. They are not even implementing at many places. When I was the chairperson, we used to visit at many factories, many industries. We have seen that they don't even know about the law. How will they implement? That is the second question, that when they don't know the law, how will they implement? That law is there, but implementation is not there. And even in many states, the government offices don't have IC, internal committees, when they don't even have. And we are talking about sexual harassment at workplace, where women can go and give the complaint. But if we won't let women live we will murder her. Where will she, how will she go even, and where will she complain? She is not even alive after such cases are happening, that she has been sexually assaulted, she was murdered, and that is extreme. But even small incidents like teasing, that is also, even women don't know where to complain. They are not aware any such law is there. We at NCW made them aware. We were doing legal awareness program, but let me tell you, NCW is a small body. We all have to stand up and talk about it. Even the government officers should implement what the law says. We need to have IC internal committee at every office, and that committee has to work without any pressure. When they don't work without pressure, whether the committee is at place or not will not and make any difference. And I have seen at many places, in many offices, though the internal committee take up the incident, they take up the matter also, but because of the pressure of higher ups, because the complaint is against the boss, this committee is unable to do anything. So unless this committee is working without pressure, unless we have proper training to this IC committee, unless we make workers aware of this law, that such law is there, this law will not make a difference. So I would again say that people should work for the awareness of the law and also take it seriously. All the workplaces should take this law seriously.
Right, and for that, they need to be held accountable. Every single workplace, whether it's a public sector workplace or a private sector workplace, there has to be, just like you get basic fundamental clearances before you set up a workplace, one of them has to be that whether your workplace is safe for women or not. If ever there was a time, if ever there was a wake-up call, then the Kolkata horror has to be that wake-up call, that this is made mandatory, compulsory, something to be adhered to, outside of which you are not allowed to have a workplace in the first place.
You're right. They have to mention it in their annual report, and annual report goes to the parliament every time, but they many a times they just say that it is nil, there is no sexual harassment happened in the company. There is no one to go and check again, recheck whether any complaint happened or not. I have visited universities, I have visited many workplaces, but again I will say this act, in fact NCW also suggested few changes in the act, because we need to have more outsider in that internal committee. Unless we have more outsider, these internal people know how to manipulate the report, and they don't. Now I think women sitting over there, they should also now speak up that we need to work without any pressure, but it doesn't happen, because everybody is bothered about their job, and for saving their own job, even the chairperson, that lady sitting in the internal committee, sometimes they also don't take proper decision on they can't take the right decision because of the pressure. So now women, when they are waking up, I will tell through you, I will request through you, every women who are sitting in the internal committee, please kindly take your work seriously, get yourself trained, know about the laws, how the law will help other women, because some time you may be the same, you may be the victim and somebody else is sitting on your chair. So work with your own conscience, work for the victim, not for your own benefit.
Right. That internal complaints committee is crucial, but also what is crucial is that how well that complaints committee handles these issues. Do you think that workplaces in India right now, especially with so many of them are private sector workplaces today, as compared to what it was say 2 decades ago, do you think all of them are first of all equipped and trained enough to put up the right kind of barriers to ensure women's safety?
That's what I told you. They, all of them, they are not even aware. These small industries, the law says that if 10 or more people are working in the committee, they should have internal committee. But these small companies where these 15, 20 people, even 100 of them, they don't even know that there is some kind of IC. Let me tell you, I have visited industries, big industry, where they didn't know that IC is some kind internal committee. Now we don't call it internal complaint committee. It is called internal committee because before redressal we need to make people aware of this. So the whole work comes under internal committee. They have to make people aware of the laws. They make people aware of the numbers of the complaint committee people. So for them it is not only redressal, it is about other things also, so that these complaints should not happen. The people should be safe, they have a safe environment in the working place. So they have the responsibility of that. But again I will say, these companies doesn't know what is the law, how should be internal committee made, how it takes complaint, how it works, how we need to talk to the victims, how to do a proper investigation, that there is a process laid out, but they don't even go through the rules, regulations. And every year, and once something happens, they just immediately change the committee members and keep people according to their own benefit. So if they don't give a free hand to these committees, if people chosen are working under those people who against whom the complaint has come, what is the benefit of internal committee? So we need to work on it properly. I think this law also needs some overhauling, and we from NCW did suggest a few changes, and hopefully the law commission will work, or the law ministry will work on those changes. We need to strengthen these IC committee. Only then I think things will change.
Okay. Now, I just want to put the focus on the fact that what the horror that unfolded at night, at midnight, in the early hours, in the wee hours. There is a case then to ensure that there is, safety first of all provided for those, workers, women workers in these late night shifts, and that's where the first fundamental concern comes from. And of course, that extends to women working across the day, all across the board.
Sure, especially inside the hospital, where anybody and everybody can walk in and go to the doctor straight away. And mostly doctors are females also these days. They are sitting on the night duties. If they are not providing safety and security, and if the culprit is from the hospital, where I can think now in this case, there was not one person who was involved in this crime. There were many, and maybe some insiders were also there, because the report says that 150 gram of semen was there inside the body of the doctor, whereas only one man semen is very less, not more than 5 to 10 grams. So how come 150 gram semen was found? So who all raped her? There are a lot of questions we need to ask from the hospital. There are a lot of questions we need to ask from the police. There are a lot of questions we need to ask from West Bengal government. I was hearing in your channel only, where CM was shouting and doing the demonstration. If the CM of the state will go on demonstration, who will work on these cases? She is now, after so many days, standing up and shouting slogans, whereas she had to act on this sexual assault and rape and murder case, which was horrible. After Nirbhaya, this was the most heinous kind of crime we have seen inside the hospital. So who is responsible if the police will not act? they have, I think they have tempered the evidences over there. There was some kind of demolition going on when the CBI, after the CBI took over. So who is going to reply all these questions? People sitting inside the hospital, there is police who need to work on this. Not only work on this, they have to come clear about so many questions I am raising, so many people are raising. The parents of the victim, they have so many doubts. They are going to the court again and again. If the state was working, if the police was working, they would not have gone to the court. CBI was not required if the police was working properly. Why 7,000 people gathered in the hospital? Why they demolished so many things? Why there was so much tampering of the evidences? Where was the police when the 7,000 people were gathered there? So who is going to ask these questions? My blood is boiling. I'm sitting here and I really want to go there and stand by the family and fight their battle. This is the time that every woman should fight this battle.
Right. As we speak, Rekha, just a short while before, you saw Mamata Banerjee taking out a rally demanding, joining a rally demanding capital punishment. So in that sense, the most important factor in ensuring workplace safety is speedy trial. You have a center's directive to all government hospitals saying that an FIR should be filed within 6 hours of the incident. So it is the speedy trial and convictions that will send the right message out when it comes to women's safety at workplaces.
Sure, yes, but if the CM is now demonstrating and asking for the capital punishment, but she is working otherwise. Their goons are demolishing the hospital and tampering the evidences. How will this person get, I will say, these persons will get capital punishment if the tampering of evidence is happening? One side, she is showing the world that she is standing by the victim, and other side, her own goons, her own police is not acting. They didn't act for so many cases, and when they acted, they just made an alibi and arrested one person, only one person, whereas the post-mortem report shows that this is not the work of one person. Where are others? Whether insiders were involved, who all, why they are saving people by tampering the evidences? Why? What is there in the evidences because of which they want to demolish them? So at one side she is showing the world that she is standing very strongly with the family, with the victim and all that, but at other side her police, and this is not the first time. Time and again I have seen that police is always sweeping under the carpet. All the cases are being swept under the carpet. They have done nothing. West Bengal police is the most incompetent police I have ever seen during my 9 years. Again, time and again I have visited and seen women crying over there. Nothing happens. Nothing. They are literally crying on my shoulder many times. But because police doesn't listen, they have to ask the CM for a small little thing every time I go there. Even if I want FIR report, they will have to call the CM and ask whether she wants them to give FIR report or not. Their DGP cannot make a statement unless he asks from the CM. So where is the fair and free and fair investigation where the victims can get the justice? And if the investigation of the police is not right, let me tell you, no judge can do anything. If the IO is not making a report properly, nothing will happen in the courts for the justice of these victims. So we need proper investigation. Now the CBI hopefully will be working, but if the evidences are already been tempered, I don't know what will they find in the evidences. So we need to sit tight and work properly, very, very properly, to book these culprits, because there is not one culprit, there are many of them, and maybe someone very, very important whom people and police want to save.
All right. Rekha Sharma, former chairperson of National Commission for Women, thank you so much for taking time out to be with us here on News 9 Live on that very important story that we're continuing to track. We are taking a very short breather here at the stage. We'll be back with lots more on the other side.
Give it to me, pass.
We'll put new glasses in the windows and they keep breaking it. This is the fourth time. You are playing football throughout the day. Will you win the world by playing football?
Yes, uncle. I will now conquer the world by playing football. Let's go to Germany.
World's largest football talent hunt, News9 Indian Tigers and Tigresses. In association with DFB Pokal, Bundesliga, BVB and India Football Center. Train and play matches in Europe. Register now and fly to Germany. IndianTigersandTigresses.com.
Big fan of Ian Bell, watching him very classy in all formats.
I find Durban quite a challenge, which is still an enjoyable one.
You're not allowed to bowl a bouncer, so that tells you that they want to see runs on the board.
बड़े अच्छे टूर्स किए हैं, बड़ी अच्छी यादें हैं हर जगह की, जहाँ मैंने पर्सनली क्रिकेट को बहुत एंजॉय किया है. ऑस्ट्रेलिया एंड इंडिया में बहुत ज़्यादा एंजॉय किया.
I love playing again England and India, and they were both very different challenges.
Up close and personal with legendary cricketers like never before. Icons of the pitch.
This and more. Streaming on News9 Plus. News is now content. Subscribe and get free vouchers.
For the very first time in our investigation, we unmasked the killer of Ravindra Matre.
In 5G, we have to stand with the world, and in 6G, we have to lead the world.
Winning a Grammy was an absolutely surreal experience.
And Muktiwani Yoda was aide to Sheikh Mujib came to my CEO. I told him that the family of Sheikh Mujib is under captivity of the Pakistani forces. The first lady came with Sheikh Mujib and she embraced me and said, God, the Allah has sent you to save us. Modi ji and the Hasina, during talk, she brought out this point again that Major Ashok Tara of Indian Army said me, my mother, my sister, my brother, we got independence on 17th December because of Ashok Tara.
This and more. Streaming on News9 Plus. News is now content. Subscribe and get free vouchers.
You're watching News 9 Live. I'm Krishna Kumar, and the big story we're putting the focus on at this hour is the scare of another possible pandemic, Mpox, that you've been reading about on your social media. The World Health Body, or the WHO, has recently classified Mpox as a global public health emergency. This comes after a surge in Mpox cases in the Democratic Republic of Congo in Africa, which is now spreading across parts of Central and East Africa. The highly contagious disease, which was earlier called monkeypox, had killed at least 450 people during an initial outbreak in Congo. At least 99,000 cases and more than 200 deaths due to monkeypox have been reported from over 116 countries since the year 2022, according to data by the WHO. Currently, scientists are concerned about how fast a new variant of this disease is spreading and its high fatality rate. The risk assessment of the virus spreading mostly in children through multiple modes of transmission has also been considered to be high. As for India, while no case has been reported so far, the risk continues owing to travel. We have a couple of special guests now joining us for more. We have Dr. Sharat Kumar Agarwal, former National President of Indian Medical Association, now joining us on the broadcast very soon. We are trying to understand whether you should be worried about Mpox or not, especially in the light of a new variant that's spreading very fast already. Sweden has announced that the virus has hit the shores of Sweden as well, even as it first began in Africa. Pakistan has also confirmed its first case of Mpox, and it has been declared as a public health emergency by the World Health Organization. Let's quickly get in some reactions first.
Välkomna hit idag till denna. Vi har också nu under eftermiddagen fått bekräftat att vi har ett fall i Sverige av den allvarligare typen av Mpox, den som heter Clade 1. Det är förstås någonting vi tar på allvar. Samtidigt är det här ett arbete som hälso- och sjukvården och de regionala smittskyddsenheterna kan och har upparbetade rutiner och system för att hantera. Den tillförordnade generaldirektören Olivia Wigsell för en närmare redogörelse för läget. Folkhälsomyndigheten samordnar arbetet på nationell nivå och har nära dialog med de regionala smittskyddsenheterna.
Vi har en person som har sökt vård i Region Stockholm som har konstaterats ha Mpox orsakad av, som vi hörde, virusvarianten Clade 1. Och fallet är det första som är orsakat av Clade 1 som har diagnostiserats utanför den afrikanska kontinenten. Den drabbade personen har också smittats under en vistelse i ett område i Afrika där det pågår ett stort utbrott också av Mpox, Clade 1. Vi kommer att återkomma inom kort. Vi har ju börjat med att titta på analyser. Vad är det för resandeströmmar det handlar om? Och personen i Sverige som har bekräftats då vara smittad har fått både vård och förhållningsregler enligt gällande rekommendationer. Och vi bedömer att Sverige har en bra beredskap för att både diagnostisera, isolera och vårda personer med Mpox på ett säkert och bra sätt.
Alla tre kommer finnas kvar för enskilda intervjuer.
And now we have Dr. Sharat Kumar Agarwal, former National President of Indian Medical Association, or IMA, now joining us. So Dr. Agarwal, thank you so much for taking time to be with us here on News9 Live. The question I'm going to ask you is this. Since 2022, already 27 cases have reported from India of Mpox. How dangerous and deadly is this new variant, and how much at risk are we here in India?
See, it is a contagious disease, virus, DNA virus. And in 22, there was an outbreak in Africa, Central, East and West Africa. And at that time also, India was not that much affected. If you can see from, as you yourself said, since January 2022 to June 24, in 2.5 years, India has reported only 27 cases and 1 death. So we can understand that the magnitude is not that much. It is mainly on the African countries and small nearby countries. Pakistan has reported many cases. So my advice is to be vigilant, but don't be panic. And it is not that worse in India. And when it will come, we'll see, because we don't require to prepare any extra thing. So what we have, I think we are able to handle the problem if it comes.
Right, but the fact of the matter is that the concern these days, wherever an outbreak is the amount of travel. Certain states in India, say from Kerala, there's so much of outbound travel across the world, and that makes India that much more vulnerable.
Yes, definitely. But see, we were vulnerable in 2022 also. That is why I'm saying, if you see there is a world outbreak by the WHO. WHO declares international, infection and outbreak in January 2022. And if in 2.5 years, we, in spite of all these international, incoming footfall in Kerala and in Mumbai, we still have only 27 reported cases. That is why I am saying that we have to be vigilant, but not to worry and not to be create any panic.
Okay. Now, there is no need. There is no need to panic at this point in time. But you do understand that we live in the post-pandemic world, the post-COVID world. Do you think that it is time already, without panicking, for Indians living in India to start taking certain precautions?
Absolutely, absolutely. See, during COVID, we understand what is the normal attire whenever you have any contagious disease or even a viral infection, the common cold. So, if somebody is having this kind of problem, basically the skin lesions. In this monkeypox, the primary symptom is the skin lesions and membranous mucosal membrane lesion with some fever, headache, and body ache. So, whenever you feel these kind of symptoms, you should the person should not coming in the crowded area. They should confine or isolate themselves, and whenever they are coming out in the public, they should wear a tight mask as we were doing during COVID. And second thing is that they should cover if there is any lesion or on the skin, they should cover it. The other thing is that we should know how it progressed, how it is spread. It is spread through touching the infected surface. So whenever we go outside, touch outside surface, we again what we do in the during COVID, the normal attire, washing your hands, putting mask, making distance, don't go in the crowded area. And if you are infection, if you think that you are infected, then you should be confined yourself in isolation. That are the precautions we should take, and we should definitely inform our doctor, because diagnosis is very difficult for the monkeypox, because the symptoms, they resemble lot many infections, and it is only diagnosed by PCR. The sample is taken from the lesion, skin lesion, or from swab, like we were doing during COVID. The throat swab or any anal or genital lesion swab, that has to be going for the PCR, and then only the diagnosis is confirmed. So I think at present we should be vigilant and following the normal behavior, the universal protection behavior, UPP, that we have to follow.
Right, Dr. Sharat Kumar Agarwal there giving us that perspective on the recent upsurge in Mpox cases. Bear in mind, the World Health Organization has declared it as an emergency of international concern. That's the term that has been given. It's the second time in 2 years that the emergency of international concern tag has been given to Mpox. There was an outbreak between July 2022 and May 2023 as well, when it was declared by the World Health Organization, the Public Health Emergency of International Concern, or PHEIC. And now again in 2024, the August of 2024, the World Health Organization has again called the Mpox outbreak in Africa a public health emergency of international concern. Dr. Agarwal, it is a public health emergency of international concern. That's the term that is given by the World Health Organization, second time in 2 years. There are vaccines that can prevent Mpox, isn't it?
There are vaccines, and they advise that after the symptom up to the 4 days, or if there is no symptom post-infection up to 14 days, a person can take vaccine and be benefited. But again, this is for those countries where the numbers are in huge. Like during COVID, we saw every country was having lot many cases. But if you ask me for India, again I'll say there is no need rush for the vaccine. There is no need to be panic. Uh, do follow a normal protective mechanism which we have learned during COVID. So in India right now there is no need to going after the vaccination of for monkeypox.
There is no need for vaccination, but do you think that the Indian healthcare system, at state levels and local level, be alerted, especially in states where there's so much of international travel? You have Sweden now reporting the case, you have Pakistan reporting a case. So in that sense, the public health system needs to be alerted at a national level.
Definitely. As you are raising this issue, it is very important issue. So that we should be knowledgeable. We should know what is happening surrounding to us. And you are very right that the state like Delhi, Maharashtra, Kerala, they should be more vigilant on that, particularly at the airport, so that we should try that the infection should not spread in our country. And that is very important. You are absolutely right.
What can private health facilities do at this stage?
See, for handling this monkeypox infection, private as well as the government hospitals, they are equipped. We don't require so many of oxygenation, ventilation like in the COVID. So it is a infection which is self-limiting unless until going for the complication, which is rare. In this infection, the total time period after infection is 2 to 4 weeks. After 4 weeks, once the lesion, the scab goes off, so it is out of danger. Yes, but few patients who are having immunity compromised, by suppose having cancer or any kidney disease or obesity or on some medicine which decrease the immunity, they have to take proper care so that the infection should not spread to other part of the body. But otherwise, the government as well as private facility in India, they are capable of handling these kind of infections.
Okay, so that's the word coming from Dr. Agarwal, former National President of Indian Medical Association, that both public and private health facilities in India are fully capable of tackling Mpox. That's now reached the shores of Sweden and Pakistan. Dr. Agarwal, my question here at this stage is this: what can individuals do? What can people like you, me, and on those watching can do? Is it time to start masking up again?
No, not at all. Again, I am saying be vigilant, be alert. If you have any, because the symptoms are same what is having during any viral infection, like common cold, the headache, the body ache, the fever. These are the symptoms commonly found in every viral infection. The only thing which demarcate from other infection is the skin lesions or the lymphadenopathy. So if you have any skin lesions with all these symptoms, then surely go for the PCR test, polymerase chain reaction test, where the sample has to be taken from the skin lesion or from the oropharyngeal throat or your any genitalia or anus, if you have any lesion there. That is the only thing. And yes, what we can do, start doing that, like I said before, whenever you go outside, you wash your hands frequently. You try to not to be in a crowded area, and you can make a physical distance. That is maximum we can do and start doing this. But again, I am reverbalizing the thing. Please don't panic.
Okay, definitely. That's the reason why we're doing this show, Dr. Agarwal, to ensure that people are not panicking. What would be your advice to Indians now traveling abroad who have trips lined up in the near future? What are the precautions that they should take?
see if those who are traveling to these outburst areas like in Central, East and West Africa particularly, uh, ideally they should avoid to going in these countries, if not necessarily. And if they are going, so they already been, they should take the vaccination and then go there. And if they are going into these area, then they should put a tight mask on them and washing their hands, and they can be vaccinated for that monkeypox.
Prashant Kumar Agarwal, former National President of the Indian Medical Association, there helping us understand how to be ready and alert when it comes to dealing with the Mpox scare. Thank you, Dr. Agarwal, for taking time to be with us here on News9 Live. And we are also putting together a complete explainer on what exactly you need to know about Mpox. Take a look at this.
Have not quite lived up to their pre-tournament billing, delivering a series of less than convincing performances. For 2 draws and a solitary win.
Your son will be Messi. No studies, just football all day. Go, my son, go. Make my face shine through playing football.
Not only your face, but also the country's. I will conquer the world by playing football. Come, let's go to Germany!
World's largest football talent hunt, News9 Indian Tigers and Tigresses. In association with DFB Pokal, Bundesliga, BVB and India Football Center. Train and play matches in Europe. Register now and fly to Germany. IndianTigersandTigresses.com.
Let's go across to Dr. Ishwar Gilada, who is an infectious diseases expert. Very warm welcome to you, sir. I want to understand from you, I will start with the basics. What is monkeypox and how does it spread?
See, now renamed as Mpox. Monkeypox has been orthopox family virus, from where we got smallpox, variola, which was used to make smallpox vaccine. There are other pox diseases called cowpox, squirrel pox, rat pox, horse pox, Alaska pox. So there are a lot of diseases which have a pox. This is one of the zoonotic diseases. Zoonotic means originally originating from animal, usually spread in animal to animal, but sometimes accidentally spread from animal to human being. Now, if it is limited to animal to human being, but not among human being, then it would have been a limited pandemic or epidemic or problem. But this is also now spreading from human to human. It is mainly spread through intimate sexual contacts. And whatever number of cases we are seeing globally, 99% of the cases are in men having sex with men.